Today we're going to talk about knee pain and kind of a general overview of the anatomy, what muscles or what can get injured in your knee, why does it happen, and kind of what muscles we need to address. And then on Thursday, we're going to do strength training for those muscles. So, general overview. This would be like you were looking at somebody's right leg, this picture right here. We've got the femur um, that runs through your thigh, goes all the way up to the hip. You've got the tibia, which is the weight-bearing bone of your lower leg. You've got the fibula, which is off to the side. The little bone that sticks out on the side of your ankle, that's your fibula. Um, the one that sticks out on the inside is actually part of your tibia. And then you have your patella. So your patella, which is just your kneecap, it just sits there, it just floats. So there's supposed to be movement. It's not really tied down by much. There is the ligament that runs over it. There's tissues, but it just kind of floats there. Some movement is normal. There are different anatomical structures as well. Like some people just have a shallow groove and their knee is more prone to pop out. Um, and other times it's really connective tissue disorder. The knee itself is more complex than the joint really looks because of how much tissue is around it. I just remember when I had a knee injury and had someone take a look at it, and he was like, "It's not as clean as an anatomy textbook makes it look." There's all types of tissue, fascia, connective tissue, cartilage, meniscus, all the things in there and around the joint. And sometimes even just the tissue can get inflamed. And so it's kind of a matter of figuring out, okay, where is this happening and how do we unload that compartment? So I wanted to show you a picture. We're just going to add muscles on top of this. Okay, I know it can look kind of confusing, but we're still just looking at legs from the front. So you've got your muscles, all types of attachments and all different bones. We've got, so the red is your muscles. The whitish is your tendons. So the tendons connect muscles to bone. Those can get aggravated. You can get patellar tendonitis. Most tendon injuries are more of an overuse type thing unless you hurt it bad enough to tear off the bone. Or something more traumatic happening. But as far as from like a hypermobility kind of overuse standpoint, you can get tendonitis of your hamstrings, which are on the back of your knee, of the patellar tendon, which is right at the front, just below the kneecap. Um, you can get subluxations or dislocations of the kneecap. So that's where it moves too far out of place to get it back in, straighten it out, unless it went really somewhere that it should not go, and that's where you would need to go to the emergency room. But in general, I'd say most subluxations you can painful, but you can straighten your leg to get the kneecap to go back in place because it is floating there. Um, so then you have your meniscus in there, you have your ligaments, ACL, you have one in the front, one in the back, two on the sides, that are your main ones you hear about. ACL, you've probably heard of that being torn pretty often. And then you have your medial and lateral, so that's the inner side and the outside of the knee causing pain. And so different structural things can cause this. Here's one. So this is where it's called genuvalgum, where your kneecaps actually your knees come in, and then that can cause your kneecap to float a little bit more outward. Sometimes this is associated with like a collapsed arch, and or your hip structure, but it can, like, there's nothing inherently wrong with this posture, but over time with a lot of repetition, you can wear down the inner side of your cartilage and of your knee joint due to repetitive impact there. Also of the ligaments, you could get a MCL, so medial collateral ligament sprain. I do think this one's more like best case scenario because that compartment of your knee has blood, which means it can heal and repair itself. As far as your meniscus and your ligaments on the inner side of your knee. So our goal with that is to offload that inner part of your knee, and we can do that with hip strengthening. We strengthen the sides of your hips. It can actually pull your knees out a little bit to unload that inner compartment. The opposite is also true. I thought I had the picture, but I don't. But like a bow-legged, so where you have too much space between your knees, that's where you can wear down the lateral, the outer part of your knee. And that's where maybe working on some more hip internal rotation, maybe some hip mobility, addressing your shoe wear, strengthening around the knee can be helpful for that. So when we're talking about treating knee pain, we need to figure out what tissue is causing this pain to address our treatment. So for most people, we talk about feet and then we talk about hips and do a lot of hip strengthening. In addition, if your knees hyperextend, they go back too far, you can overstretch those ligaments as well. And so we also want to make sure your quad, so that's that muscle right on the front of the knee, is strong, and that can help us to prevent like patellar like tendonitis. We want to make sure that muscle is really, really strong. But in addition, you can see all the muscles that attach to the knee. The calf is in the back of the knee that attaches back there. And we really want to make sure all the muscles around the knee are strong, but we cannot forget the hips and the ankle. And that's the main thing I wanted to touch on today is how important hip strengthening is, especially when you have a structure like this. Because of that femur that goes all the way up to your hip socket. And then your tibia goes all the way down to your foot. And those are your weight-bearing bones. We've got to address it. There are other like cartilage issues we can have in the joint. But even with that, I found that majority of injuries of the knee, unless it's a traumatic injury like ACL, where maybe you choose to go the surgical route if you are in like competitive sports or something, that learning to unload those areas that are overused and strengthen all of the muscles around the knee, the hips, and the ankle tend to clear up most general injuries and at least help us manage them. There is arthritis that you can get in your knee, and that's where some people normally later in life choose to get a knee replacement. And that's because maybe there's so much movement in the knee, it wears down, or so many injuries, it wears down over time to where the bone actually gets worn down, and you'll get arthritis to where you don't have much cartilage left. But even with that, or even an early onset of arthritis, strengthening and making sure we have both mobility and strength will and can help relieve symptoms. This is a very short overview, but gives you a little visual of why we are going to strengthen all around it. So we will talk on Thursday and run through a workout together for what I recommend for knee pain, specifically for Thursday. We're going to talk about kind of that inner knee pain and like the front of the knee. So thank you for watching. Drop any questions or anything else you want to learn about the knees in the comments so that I can make a future video on it. But thank you for watching, and I will see you on Thursday.